Hello everyone and welcome to my channel. In this video, I'm going to talk about preterm labor, a condition that can affect pregnant women and their babies. I'll explain what it is, what causes it, how to recognize the symptoms, and how to treat it. What is preterm labor? Preterm labor is labor that begins early, before 37 weeks of pregnancy. A normal pregnancy lasts about 40 weeks. Preterm labor can result in premature birth, which means your baby is born before it is fully developed. Premature babies can have health problems such as breathing difficulties, low birth weight, bleeding in the brain, and infections. What causes preterm labor? The exact cause of preterm labor is not known, but there are some factors that can increase your risk of having it. Some of these factors are: having a previous preterm birth, having a multiple pregnancy, twins or more, having an infection in the uterus or vagina, having a short cervix or a history of cervical surgery, having problems with the placenta, such as placenta previa or placental abruption, having a history of uterine surgery or fibroids, having chronic conditions such as high blood pressure, diabetes, or kidney disease, having a history of smoking, alcohol use, or drug abuse, having a lot of stress or trauma, being underweight or overweight before pregnancy. What are the symptoms of preterm labor? Some of the signs and symptoms of preterm labor are: contractions that occur more than 4 times in an hour and do not stop with rest or hydration, cramps or pressure in your lower abdomen or back, fluid leaking from your vagina, rupture of membranes, vaginal bleeding or spotting, change in vaginal discharge, more watery, mucus-like, or bloody, pelvic pain or pressure. If you have any of these symptoms, you should call your healthcare provider right away. Preterm labor can progress quickly and endanger your baby's life. How is preterm labor diagnosed? Preterm labor is diagnosed by checking your cervix for dilation, opening, and effacement, thinning. Your healthcare provider may also perform a pelvic exam, an ultrasound, a fetal heart rate monitor, and a urine test to check for infection. You may also have a test called fetal fibronectin, FFN, which measures a protein that is released when the placenta separates from the uterus. A positive FFN test indicates a higher risk of preterm delivery. How is preterm labor treated? The treatment for preterm labor depends on how far along you are in your pregnancy, how severe your symptoms are, and how well your baby is doing. Some of the possible treatments are: bed rest and hydration. You may be advised to lie down on your left side and drink plenty of fluids to reduce contractions and prevent dehydration. Medications. You may be given medications to stop or slow down contractions, tocolytics, prevent infection, antibiotics, prevent bleeding, antifibrinolytics, or help your baby's lungs mature faster, corticosteroids. Cerclage. If you have a weak or short cervix, you may have a stitch placed around it to keep it closed and prevent premature delivery. This procedure is usually done before 24 weeks of pregnancy. Pessary. If you have a short cervix, you may have a silicone device inserted into your vagina to support your cervix and reduce pressure on it. Magnesium sulfate. If you are at risk of delivering before 32 weeks of pregnancy, you may be given magnesium sulfate through an IV to protect your baby's brain from bleeding or damage. Delivery. If your condition does not improve with other treatments, or if there are signs of distress in you or your baby, you may need to deliver your baby early by induction or cesarean section. How can I prevent preterm labor? There is no sure way to prevent preterm labor, but there are some things you can do to lower your risk or manage your condition better. Attend all your prenatal visits and follow your healthcare provider's recommendations. Monitor your contractions and report any changes or concerns to your healthcare provider. Eat a balanced diet that includes folic acid, iron, calcium, and omega-3 fatty acids. Drink plenty of water and avoid caffeine, alcohol, tobacco, and drugs. Exercise moderately with your healthcare provider's approval. Avoid heavy lifting, prolonged standing, and sexual activity if you have a history of preterm labor or cervical problems. Manage stress and practice relaxation techniques such as breathing exercises or meditation. Conclusion. Preterm labor is a serious condition that can affect pregnant women and their babies. It is important to know the signs and symptoms and seek medical attention as soon as possible. Preterm labor can be treated with medications or delivery depending on the situation. Preterm labor can be prevented or managed by following a healthy lifestyle and attending regular prenatal care. I hope you found this video helpful and informative. If you did, please give it a thumbs up and subscribe to my channel for more videos on pregnancy and health topics. Thank you for watching, and I'll see you in the next video.